So what can we do about these system issues? So I'll start with this quote, which really underscores the importance of dealing with the system issues by Maslach, that we should be trying to identify and analyze the critical components of bad situations in which many good people function. Imagine investigating the personality of cucumbers to discover why they have turned into sour pickles without analyzing the vinegar barrels in which they have been submerged. So sometimes we may be blaming the person, but we have to understand the system within which they work. So Sam took us through the personal factors and the system factors that will contribute to burnout. And maybe I can refresh your memory and just try to understand from you what of these factors can we change? Which of these factors can we change? And what can we do to change those factors? So I grouped them like this, but of course they are very similar to what Sam said. Workload, which was also demonstrated in the role play, emotional demands, work-family interference, role conflict, lack of supervisor support, lack of control, values incongruence, and the others as you see them. So as a leader or a future leader, what do you think we can change? And how can we change it? And I had some just suggestions which are really very similar to what you've said. Someone has mentioned about workload, what we can do. Of course, plan what, according to what needs you have and the resources you have. Control, of course, avoid the top-down control method. Reward, as also has been mentioned. Community. So you have, it's better to have unit-based pride. We all win together. I think one of our professors used to tell us we shouldn't be a team of champions, but a champion team. All of us win together, and that not some individuals are winning, others are just supporting them to succeed. And fairness, again, that's what you brought up, Dr. Dungu. And values. It's important to model integrity and create processes for handling moral distress. We should have in our systems processes that can handle moral distress. So this picture is just showing that in trying to reduce burnout, it's the responsibility of both the individual but also the organization or the organization leaders. They have to work together to devise strategies that will control or prevent burnout. And it's not either or. These have to be together. So how about burnout and palliative care? So a common thing when I meet colleagues or when people ask me, what are you doing? These days I say, I work in palliative care. So their faces change suddenly and they say, oh, they become sympathetic and say, aren't you depressed? Aren't you stressed? So, well, and many times I say no. But definitely, of course, it's stressful in palliative care, but I'm not distressed. But I think the same can be asked of any other doctor because the patients we see in palliative care are not different from the patients you see. It's maybe we may have some unique stressors. So, of course, we are exposed to many potential stressors, both personal as well as systemic. And the ones that tend to be more common in palliative care are dealing with death and dying, of course. You all do, but maybe for us with more frequency. And having to make ethical decisions because these are people who are dying. And communication difficulties with patients and families. Someone today just told me that communicated to a patient and the patient cried, an adult male started crying. So that can be stressful. The other day we had a patient on the ward. The family couldn't get to grips with the fact that their father was dying because he meant very much to them. And so it was very difficult to communicate with them. And they had all these reactions which were very difficult to handle. And also, many times we will identify with the patients because we talk with them longer. And when we lose them, of course, we grieve. because we've lost people we know. And the risk factors for burnout in palliative care, as you see, are very similar to the ones that Sam talked about. They are not different from any other health professionals. And of course, these are the same things that they talked about. However, review of research has shown that palliative care clinicians are not at a greater risk for burnout as many people may anticipate. Because we are dealing with dying, many people think that maybe we are more susceptible to burnout. But actually, research has shown that we are not. And sometimes actually we are better at, we have less chances of burnout than, say, when they compared us to oncologists. And why does this happen? What are those things? Are there things that some other people may learn from us? So, I hope you can see this one. Very small maybe. But this review also showed that, of course, there are many risk factors, but it identified that there are protective factors among palliative care physicians that lead to less burnout or make us have unexpected levels of burnout as compared to what people would expect. And these were both individual and team strategies and included spending more time with patients. Turns out that spending more time with patients made people's lives more meaningful. And as you know, Gary just talked about how mean making is very important for resilience. And the other one was establishing effective communication was also very important. People also had come up with coping strategies for facing death of a patient, like reflection on a patient when they died and what caused the death, and that tended to protect them against burnout. And all these strategies led, especially that those that created meaning in people's lives, brought personal enrichment, and that also brought meaning to life and also prevented burnout, and also led to personal gratification. This is another study that also showed that palliative care physicians use many personal strategies to be able to prevent burnout. And of course, this was a qualitative study of 30 hospice and palliative medicine physicians, and showed the different things that Gary talked about, the personal factors, what people can do, and the strategies, the personal strategies they use. And you can see physical well-being was the most commonly used strategy, and enhancing professional relationships with colleagues. The transcending, maybe most times making meaning, and talking with others. There are lots of other things. So this study actually was done in 2009, but earlier on, a similar study had been done among oncologists to show what are the strategies they used. And then they compared these two studies, and they found that these strategies were more used in palliative medicine physicians as compared to oncologists. Of course, they are very small studies, and it's very difficult to compare, but maybe they may imply that using these strategies may be protective to people in palliative care. So, what can managers do? These are some of the suggestions we think that can help, which came from this book. It's important to train people on burnout or compassion fatigue. As Gary said, that identification is very important, knowing where you are on the spectrum, because it's the start. Because every time also we use it in medicine. Before you can treat a problem, you have to make a diagnosis. And therefore, identification is very important. We should emphasize celebrations in teams. So people who have achieved should be celebrated. It's important to do a risk analysis of burnout for your work area and raise the topic in team meetings. And create unit-specific processes for dealing with burnout. So they should be, as managers, you should have processes that can deal with burnout. And also model talking about burnout so that it becomes as part of normal team life. Should be that managers should look at burnout as a problem in healthcare as they look at other things like infectious control, infection control, because of the impact it has. So if you want actually to evaluate yourself, if from this exercise you have not already known where you are on the burnout spectrum between engagement and burnout, these are the resources you can use. You can Google these, I think. Are they on Google? Yeah. And then fill out the scores and find out where you are. Because we know that identification is very important before you can think of using these strategies. But of course, the strategies should be used in everyday life as we face the stressors. So in summary, as I said in the beginning, burnout is very common but under-recognized, and it's an occupational hazard. So for both prevention and treatment, we should pay attention to the personal factors and the systemic factors which predispose to burnout. And resilience may be fostered by a number of possible interventions that we've taken you through, and it's important that you incorporate these in your day-to-day living. So I'll leave you with this to think about. What is your plan?